Welcome to the Deep Dive. We're the podcast where we take a whole stack of info articles, research, maybe some notes, and really unpack the key takeaways for you. Our goal is simple. Give you that shortcut to being well-informed, maybe with a surprising fact or two, and hopefully keep it interesting. Today we're diving deep into, well, a pretty intricate topic in veterinary medicine, equine orbital disease. We've got these excerpts from Equine Orbital Disease, Causes, Diagnosis, and Treatment, and they cover, the basics, the signs, causes, how it's diagnosed and treated. So if you've ever been curious about what's actually going on behind a horse's eye or how one specific area can be hit by so many different problems, then yeah, you're definitely in the right place.
It's fascinating, really. What strikes me is how often these orbital issues, they aren't just about the eye. They can really be a window into wider problems in the horse's body, connections to the respiratory system, even dental health. It's quite something.
That's a really powerful connection. Okay, let's get into it then. Let's explore the equine orbit. First off, just so we're all on the same page, when we say the orbit in a horse, what exactly are we talking about?
Right. So the equine orbit is essentially that bony socket, the cavity that holds the eye, the globe itself. It's made up of several bones, frontal, lacrimal, zygomatic, temporal, and others forming the inner wall. And unlike us or some other animals, a horse's orbital rim is complete. It's a fully closed, sort of cone-shaped cavity, strong protection for the eye.
Okay, so it's definitely more than just the eyeball sitting there. What else is packed into that space?
Exactly. Yeah, way more. Beyond the globe, the orbit is full of critical supportive structures. Think extraocular muscles for movement, glands, quite a bit of fat for cushioning, connective tissue called fascia. Plus, it's like a junction box, really. Lots of little openings, foramina, letting nerves and blood vessels pass through, and the tear drainage system runs through there, too.
Got it. So if any of those bits and pieces have a problem, that falls under the umbrella of orbital disease.
Precisely, yeah. Any kind of pathology, any issue affecting those extraocular tissues or the bone itself, that's orbital disease. And when that happens, well, it can mess with function, cause discomfort, pain, and down the line, potentially threaten vision.
Right. Makes sense. And the sources mention sort of main ways these diseases actually develop.
Yeah, there are essentially three major mechanisms we see. First is compression, like something's growing in there, a tumor, an abscess, and it's pushing everything else out of the way.
Good.
Second is anatomic rearrangement. Think trauma, like a fracture or maybe another disease process physically shifting things around. And the third is invasion from a systemic illness. So a problem starts somewhere else in the body and then spreads into the orbit. It really drives home how interconnected everything is in a horse.
Absolutely. So given all those structures and those ways things can go wrong, it sounds like orbital disease could signal problems way beyond just the eye itself. What other systems might be involved?
Oh, definitely. It really can pull in a lot of different systems. Obviously, the ophthalmic system, the eye itself, but also the musculoskeletal system because of the bones involved,
Right.
The vascular system, the nervous system, and importantly, the upper respiratory system. We're talking sinuses here, too.
Wow, that's a broad reach.
Yeah.
Does this tend to affect certain horses more than others? Like, is there a typical signalment?
The research does point to some interesting trends, yeah. For example, older horses seem to be more likely to develop neoplasia tumors in the orbit,
Good.
whereas younger horses, like foals and yearlings, and also really active horses, maybe polo ponies, they might be more prone to acute trauma, fractures, things like that.
Right. So age and activity play a role.
It gives you clues about different risk factors, definitely.
Okay, so for someone listening, maybe a horse owner or carer, what are the key signs they should be watching for if they suspect an orbital issue? I guess the signs would vary a lot depending on the cause.
They do vary, absolutely. But there are some classic indicators, things vets look for. One big one is exophthalmos. That's EXOPHAALMOS.
And that means?
That means the eye is bulging forward. It's displaced anteriorly. Often you can't easily push the eye back into the socket, what we call retropulsing it. You might also see the third eyelid sticking out. The cornea might look dry because the eyelid can't cover it. That's exposure keratitis. Or the horse just can't fully close its eyelid, which is legophthalmos.
Okay, bulging out. And can the opposite happen too? Can the eye sink back in?
Yes, exactly. That's called enophthalmos. ENOPH. You get it. The eye looks sunken.
Uh-huh.
This can happen if the tissue behind the eye shrinks or wastes away, maybe due to nerve damage or even some types of orbital fractures. And you often see that third eyelid protruding here too.
Interesting. So besides bulging or sinking, what else might you actually see around the eye that looks wrong?
Well, you might notice strabismus, that's misalignment, like a crossed eye. Or obvious swelling around the eye socket itself, the periorbita. Sometimes there's orbital asymmetry where one side of the face just doesn't match the other. That could be from fractures or inflammation cellulitis or even air trapped under the skin. Orbital emphysema. Eyelid swelling, blepharodema is common too. And swelling of the pink tissue, the conjunctiva, that's chemosis. Corneal edema, where the cornea looks cloudy, can also show up.
Okay. And what about, discharge? Or just signs the horse is uncomfortable?
Definitely key signs. Epiphora, that's excessive tearing or other kinds of discharge from the eye, are very common.
Right.
Vision loss is possible, of course, usually just in the affected eye. Yeah. And here's that link to other systems again. If the sinuses or upper airways are involved, you might see nasal discharge, maybe even a nosebleed, epistaxis, or you might notice the horse isn't getting as much air through one nostril. And a vet might hear abnormal sounds when they tap over the sinuses.
Okay, that connection is really clear there. Any other really serious signs maybe indicating long-term damage?
Yeah, a particularly severe sign is phthisis bulbi. PHTHISISBULBI. That's basically when the whole eyeball shrinks and atrophies. It's pretty serious.
Oh, wow.
And then, of course, the general signs you'd expect with something painful or inflammatory fever, obvious signs of pain or distress, always important.
This is where it just gets, well, kind of mind-blowing, really. The list of things that can cause equine orbital disease is incredibly long and varied.
It truly is. It's vast. Trauma is definitely a major player that can lead to orbital fractures, obviously, or widespread inflammation of the soft tissue cellulitis. And in severe cases, even proptosis, where the whole globe is actually displaced forward, like out of the socket.
Yikes. I can also easily imagine things like splinters or debris being a problem there, too. Foreign bodies.
Absolutely. Foreign bodies getting lodged in there are a known cause, often leading to nasty orbital abscesses. And then you have this whole massive category of orbital neoplasia, tumors. And the list of documented tumors found in a horse's orbit is, well, it's extensive. You've got things like meningioma, lymphoma, melanoma, sarcoids, squamous cell carcinoma, various sarcomas like hemangiosarcoma, angiosarcoma. I mean, the list goes on and on. Neurofibroma, schwannoma.
Wow. There's a lot of different types of tumors to consider. What else is on this list of causes?
Well, we also see pyogranulomatous diseases. These are chronic inflammatory conditions, often caused by specific bugs like certain fungi or bacteria. Even things like epizootic lymphangitis can manifest there.
Okay. So infections, but specific chronic types.
Yeah.
Are there less obvious things, maybe structural issues?
Yes, definitely. You can get various kinds of cysts forming back there, things like retroorbital cysts, dermoid cysts, even dentigerous cysts, which are related to tooth development. And then there's the issue of problems starting near the orbit and spreading into it.
Ah, like the sinus connection you mentioned.
Exactly. Things like guttural pouch disease, which is specific to horses, or sinusitis affecting the sinuses right next door, the frontal maxillary sphenopalatine sinuses. And remarkably, even tooth root abscesses from the upper teeth or sinus neoplasia, tumors in the sinuses, can extend right into the orbit.
So wait, a bad tooth could actually present as an eye problem? That's a connection I bet a lot of people wouldn't immediately make.
It's a prime example of that interconnectedness we talked about. It really highlights why vets need to think broadly.
It does.
And believe it or not, the list keeps going. More unusual causes include things like orbital fat prolapse, where the fat pad bulges out, or varices, which are like swollen veins in the orbit. Even parasitism-specific parasites like hydatid cysts or worms like Halocephalobus gingivalis or Strongylosis dentatus can end up there.
Parasites, wow.
Yeah, and even in some cases, nutritional myopathy, muscle disease related to diet. It just shows the sheer diversity of potential underlying issues.
Okay, so with this huge range of potential causes and signs that can overlap or point to different things, figuring out what's actually wrong, that must be a real diagnostic challenge. How do vets tackle that?
Diagnosis is absolutely key. And yeah, it can be like putting together a puzzle. It involves several steps. First is working through the differential diagnosis, basically ruling things out and narrowing down the possibilities. For instance, that bulging eye, exophthalmos. You need to be sure it isn't boophthalmos, which looks similar but is actually an enlarged globe, usually from chronic glaucoma. Different cause, different treatment.
Right.
And you also have to consider, is this truly an orbital problem? Or is it stemming from something nearby, like the sinuses or teeth, that's just affecting the orbit? That distinction is critical.
Are there specific lab tests that help? blood work?
A basic blood panel, a CBC, might show some general signs of inflammation like high white blood cells or fibrinogen. But those are nonspecific, they just tell you something is inflamed. If a systemic illness is suspected as the root cause, then yeah, more specific blood tests or other diagnostics would be needed to track that down.
Okay. And imaging. I imagine that's crucial for looking inside such a complex bony structure.
Oh, imaging is huge, very, very important. Skull radiographs, x-rays, can give you a basic look at the bones. Orbital ultrasonography is great for looking at the soft tissues within the orbit muscles, fat, potential masses or fluid.
Okay.
But really, CT scans are often the ideal choice, especially for getting detailed views of fractures or complex lesions involving both bone and soft tissue.
Right. CT gives that cross-sectional view.
Exactly. And MRI is another powerful option, particularly good for soft tissue detail, maybe more readily available or practical for foals or smaller ponies sometimes.
Makes sense. What about actually getting a sample from the affected area itself? Biopsy or aspiration?
Yeah, that's often necessary to get a definitive answer. Depending on what's suspected, the vet might perform an aspiration using a needle to dry up fluid, maybe from a cyst or abscess, or a biopsy to get a small piece of tissue, perhaps from a mass.
Okay. And those samples are then sent off for analysis? Cytology to look at the cells, microbial culture and sensitivity if infection is suspected,
Right.
to see what bug it is and what kills it. And histopathology, where they examine the tissue structure under a microscope, which is crucial for identifying tumors or specific inflammatory patterns.
It's quite a workup.
It can be. And sometimes you might need even more invasive diagnostic steps. An orbitotomy, which is actually surgically exploring the orbit, can be both diagnostic, letting you see what's going on, and therapeutic, allowing you to remove something.
Yeah.
But it's a tricky surgery.
I bet.
Or, if the sinuses are clearly involved, trephination might be needed. That's drilling a small hole into the sinus for culture or to flush it out and drain it.
Okay. And what about that scenario you mentioned earlier, proptosis, where the eye has actually popped out due to trauma? How is that assessed? Yeah. In cases of proptosis, a very careful ophthalmic exam is absolutely critical right away. The vet needs to determine if the eye has any chance of remaining viable if it can be saved. Signs like a really constricted pupil, super low pressure inside the eye, hypotony and blood in the front chamber, hyphema. Those usually indicate severe trauma and, sadly, a poor prognosis for vision.
Right, a tough situation. So, okay, once you have a diagnosis, how is equine orbital disease typically treated? I'm guessing, given everything we've said, it must depend entirely on the specific cause.
You hit the nail on the head. Treatment is highly dependent on the underlying cause. It has to be tailored. For instance, minor orbital trauma, maybe just some bruising and swelling, might be managed medically with anti-inflammatories and rest.
Okay.
But surgical intervention is often needed for things like significant fractures that need stabilizing, or certainly for removing orbital tumors or draining large abscesses. Usually, even with surgery, the hospital stay might be relatively short.
And what about managing the horse during recovery? Activity levels, diet.
Activity really depends on how much vision is impaired and how comfortable the horse is. Stall rest is often recommended, especially right after a major surgery or if the condition is very painful. You want to limit head shaking or further injury.
Makes sense.
Diet usually doesn't need changing unless the underlying problem was somehow related to malnutrition causing tissue atrophy, which is rare but possible. Now, regarding the outlook for vision, for primary orbital disease, the prognosis is often guarded, at least initially. You have to see how things respond. And in those really severe, painful cases where the eye is irreversibly blind or with certain aggressive tumors, sometimes the kindest option is orbital exenteration. That's the complete removal of the globe and pretty much all the other tissues within the orbit. It's a major procedure, but sometimes necessary for the horse's comfort and quality of life.
That sounds like a very drastic step, but I understand why it might be necessary. Are there less invasive surgical options that might be tried first, maybe to save the eye or appearance?
Yes, absolutely. If you have, say, a well-defined cyst or a solitary tumor behind the eye that isn't invading crucial structures like the optic nerve, then an orbitotomy might be performed just to remove that specific lesion, aiming to preserve the sighted eye.
Okay.
If the eye itself is painful and already blind, then enucleation is often the way to go. That's removal of just the eyeball, along with the conjunctiva and the third eyelid.
Right, removal of the globe.
Exactly. And after enucleation, if the risk of infection or tumor coming back is low, sometimes an intraorbital prosthesis, basically a silicone ball, can be placed in the socket to help maintain a more normal facial appearance.
Interesting.
There's also another technique involving an intrascleral prosthesis placed inside the scleral shell after the eye's contents are removed. But that's only suitable if the cornea is healthy and there isn't significant bulging or eyelid closure issues.
Okay, different options there. And what about fixing those bony fractures around the eye we talked about? Is timing important?
It's very important. Periorbital fractures should ideally be repaired quickly. Why? Because fibrous tissue starts forming rapidly, and bony union can start to happen, sometimes making repair much harder, even as soon as a week after the injury.
Wow, that fast.
Yeah. And another thing we use surgically are tarsorrhaphies.
Persorwa.
Tarsorrhaphies. It's basically temporarily suturing the eyelids shut, or sometimes partially shut. It's really beneficial for protecting a proptosed eye while the swelling goes down, usually kept in place for 1 to 2 weeks. They're also used in cases of facial nerve damage where the horse can't blink, or other conditions like dry eye or logophthalmos to protect the cornea.
Got it. Okay, let's switch gears to medications. What are the main medical tools used in treating these orbital issues?
Well, systemic antibiotics are pretty standard if there's trauma or if infection or cellulitis is suspected or confirmed. Got to fight off those bugs.
Right.
If parasites are diagnosed as the cause, then obviously anthelmintics dewormers are needed. The eye surface itself often benefits from supportive care, like topical ophthalmic lubricants to keep it moist, or maybe topical antibiotics if there's a surface infection or ulcer.
Okay. And for pain and swelling?
Anti-inflammatories are key. Systemic NSAIDs like flunixin, maglumin, banamine, or phenylbutazone bute are commonly used to manage that periorbital swelling and pain. And if the initial trauma also caused inflammation inside the eye, uveitis, that needs aggressive treatment too, often with both topical and systemic anti-inflammatories. But there are really important caveats with medications.
Oh, like what?
Well, topical steroids are a definite no-no if there's any kind of ulcer on the cornea. They can make it much, much worse.
Good to know.
And also, long-term use of those systemic NSAIDs, bute and banamine, while great for pain, they carry risks of significant side effects like kidney problems or gastrointestinal issues like ulcers or protein loss, so they need careful monitoring.
Right. Always a balance. Are there any sort of alternative or maybe more advanced treatments for the really tough cases, especially the tumors?
Yes, there are some options for specific situations. For certain types of neoplasia, things like intralesional treatments might be considered. That could be radioactive iridium implants placed directly into the tumor, or injecting chemotherapy drugs like cisplatin right into the mass.
Interesting. Targeted therapy.
Exactly. And for orbital lymphosarcoma, which is a type of cancer, systemic chemotherapy combined with corticosteroids is often the treatment approach.
Okay. So treatment is done, maybe surgery happened.
Yeah.
What does the follow-up look like? What's the long-term picture for a horse that's had orbital disease?
Recheck exams are really important, especially after surgery to monitor healing, or with aggressive tumors to watch for recurrence. And unfortunately, even with successful treatment of the initial problem, there can be long-term consequences. Things like permanent eyelid paralysis, chronic keratitis inflammation of the cornea, or chronic dry eye, KCS, or maybe intermittent nasal or ocular discharge that just keeps happening. These might require lifelong management, like daily medications or lubricants. And of course, providing a safe environment, minimizing risks for future trauma, that's always a good preventative measure too.
So ongoing care might be needed.
Often, yes. And owners need to be aware that recurrence of tumors is possible, reinfection can happen, or persistent pain and swelling might linger. Ultimately, yeah, blindness and even loss of the eye are potential outcomes in severe cases. The prognosis is just incredibly variable. It really hinges on getting the right diagnosis quickly and starting the appropriate treatment. Some issues, like maybe a simple fracture from trauma, might be a one-off event, although it could leave lasting effects. But other diseases, like some aggressive cancers, might only be managed palliatively, focusing on comfort, and may never be truly cured.
So wrapping this up, what does this all really mean for us, for you listening? I think this deep dive into equine orbital disease, it just perfectly illustrates the incredible complexity we see in veterinary medicine and how something that seems so localized, like a problem with the eye socket, can actually have these deep systemic roots and ripple effects throughout the horse's body.
Absolutely. If you connect this to the bigger picture, it just highlights how vital a really thorough diagnostic workup is. You can't just look at the obvious symptom. And it stresses the need for these highly individualized treatment plans. You can't have a one-size-fits-all approach when the causes range from, a simple bump to a rare parasite or a really complex tumor.
Yeah, what really stands out to me is exactly that, how something affecting the orbit can stem from a tooth root abscess or a sinus issue,
or even rarely diet. It just makes you really appreciate how interconnected a horse's body is, and how crucial that deep understanding of anatomy, pathology, the whole picture, is for keeping them healthy. So what are your thoughts on this amazingly intricate system? We really hope this deep dive has given you maybe a fresh perspective, perhaps an eye-opening one on that hidden world behind a horse's eye, and maybe a greater appreciation for the challenges and the successes of equine veterinary care.